up to hardware and I bought 12 bags of topsoil. And after I got them unloaded, I noticed for the first time in my life I had a pain in my chest. So we went to our family doctor and I told him my story, and he says, "You're going to go and have a stress test."
Bob had seen his primary cardiologist for some shortness of breath, and I think in the midst of his workup had a stress test, an echocardiogram, a heart catheterization, and then a CAT scan, and was found to have a very narrowed heart valve, and then was sent to me to have that evaluated and then worked up for a possible aortic valve replacement. And in the midst of doing that CAT scan, we found a very dangerous enlargement of his aorta, the big blood vessel in his abdomen. And so that's when we called Dr. Moawad in to consult with us on how we're going to deal with these two separate but each life-threatening problems.
And they stumbled upon a 9-centimeter aortic aneurysm. That's about 4 to 5 times the normal size of an aorta. So we had some concerns about what needed to be fixed first. As a surgeon, we're always very concerned about any procedure or anesthesia in light of aortic stenosis. That's usually something we want to have taken care of and fixed first before putting somebody through a major procedure.
So he took me in and he went through the wrist and he put that stent in. And it was as different as day and night from that day on. When they got done, I had to go in the hospital room for 1 day and got an awful nice nurse. And she said to me, "Now before you go home, you're gonna have to walk around this room twice." And she was in a space there with a thing in her ears, and she hollered out to me. She says, "Your heart hasn't changed one thing. You're just doing great." And I knew then, man, whatever they did, it's working.
He, was very active, and then kind of all of a sudden these symptoms cropped up and had these diagnoses given to him and had these procedures done, and almost as quickly he was back to his old self again, which is great.
Well, that's, I think, the advantage of a lot of these minimally invasive techniques, whether it be the aortic aneurysms or the valves, but the goal is not just to fix the problem, but to get the whole patient back to enjoying life. These minimally invasive techniques allow people to bounce back much faster.
I can still make a clock. I can still be in the garden. I can still mow the grass because of Summa. There's no other way I can add to it.